Hi, I'm Josh McDonald.
And I'm Random Materi, and we are Hand Therapy Academy.
So let's talk a little bit about the CHT exam. We do tons on that and we love talking about it a bunch and all the different nuances of it. But let's talk a little bit about the people who struggle and don't pass and maybe some of the reasons why people don't pass and how we can kind of overcome those before you get there. So hopefully some of those things don't happen to you. So,
Yeah,
Miranda, what would you say is the one of the top reasons you feel like people don't end up passing?
I really feel like because I'm usually the one that's like mentoring people after they don't pass or they call, I don't know. It seems like we kind of have different roles, and that is one of my roles. So, and I spend a lot of time like interviewing and meeting with these people, and I really feel like it's related to performance anxiety. So, a lot of times, these people that are going in and taking the exam, they have so much anxiety they can't even think straight, right? Because I've met with these members before. I know they know the information and the content we're talking about, and we're talking through it, and they know the stuff. It's strictly just a lack of confidence from anxiety. So
Yeah,
it's
yeah.
always like telling them, like trying to build up their confidence. And I think ways you build up your confidence is, prepping properly and doing practice exams and getting a good night's sleep. And then if you need further interventions beyond that, those are some things we talk about as well.
And I feel like there's so much built up about the test that just feeds into that anxiety and stress about it. And it's this, we tell people on our last meeting of the 6 month cycle, one of the things we say is relax. This doesn't define you as a person. That doesn't define you as a therapist. This is part of the process and just go into it less stressed because people feel like this is a pass fail on them as a person or therapist. And there's been so much anxiety built up around the situation that it's helpful just to kind of take a deep breath and hopefully let that affect you less.
Right. And then I think some people just don't know how to take tests, right? Like I know especially like with my two girls, I have one that you could give her any test and she'd probably do well on it, and then the other one would know the content really well and not do well. So I think so much of it is being a good test taker as well. And how do you become a good test taker? You practice, right? You practice and then you learn to eliminate questions and you learn to really figure out what the question's asking. So if it's asking a question about an evaluation, your answer should have something about an evaluation in it, right? Or if it's an assessment, you're making sure you're looking for the question with an assessment and nothing else, right? So there's a lot of tricks you can use to eliminate what's not needed. But people who aren't good at taking tests sometimes just don't have those strategies in place or haven't learned those strategies.
Yeah, it's kind of a logical line of thinking that if it some people comes naturally to, and some people it doesn't, and they have to kind of push that a little bit and make it happen to say like, well, if they're asking me a question about nerve pathways, then I know the answer is not going to be one of these because that's not even the right context. And I know this one is the wrong nerve. And so you can start process of elimination. You can start to look at the logistics of the question, and that can guide you getting outside of that anxiety about like, oh my gosh, here's another question. You're 172, and it gets overwhelming.
Right. Because a lot of times you can figure out the answers and not really know the content as well, right?
Yeah, yeah, for sure, for sure. Another reason I feel like the test pass rate in general is so low. I think now they're calling it like 55, 60% pass rate, something like that, which honestly is an improvement. And I think there's each time I feel like there's more people passing the CHT exam. And so the profession is growing well. I think that's a good thing happening. I feel like people underestimate the level of complexity of the material to study. I think this last cycle, two or three different times, I got people reach out on Instagram or email or whatever and say, "Hey, here's where I'm at. I do this all day long at my job. I really think I have it. My coworker said I should pass no problem. Do you think I even need to study for it?" And my answer is 100% yes. Even if you don't use all of our stuff, by all means, you have to study because whatever clinic you're in, there are contexts that you don't work with at all. If you work in an outpatient ortho clinic, you're not dealing with arthritis and scleroderma, and you're not maybe not dealing with shoulders, or maybe you're not dealing with amputations or pediatrics, or there's going to be areas you just don't know. And then the depth of information. I've been doing this for long enough, but that doesn't mean I could answer and draw the brachial plexus off the top of my head. That doesn't mean I could tell you all the anastomoses off the top of my head. So there's a depth of knowledge you have to have that you can't go into without studying for.
Right. And that depth of knowledge isn't always presented, like you said, in the clinical basis. Like, right, like some of the anastomoses, like those you just have to memorize, right? Because we may talk about a Martin Gruber in someone's chart, but I don't think I've ever seen some of the other anastomoses talked about at all.
Yeah, yeah. And it's that minutia of detail that you just aren't going to come into in a clinic. You can have absolute confidence in your day-to-day treatment, but that doesn't mean you know what walking into that test what they're going to ask about. So I think people maybe underestimate thinking I've been doing this for 10 years in the clinic, I'm totally fine with this. Maybe not.
Right. And you may be able to problem solve through some of it, but
Yeah,
yeah.
yeah, yeah. Any other big reasons why you think people struggle to pass the test? Anything else that jumps to your mind that's
So we talked about performance anxiety. We talked about just not being a good test taker. Um, I think some of it too is because it used to be where it was 5 years, right? When you and I took the exam, you had to be in practice for 5 years,
yeah,
and now it's 3 years. So I feel like there sometimes people just don't have those extra 2 years to of even clinical experience to learn things, right? So I think that's a little bit of a disadvantage. And if you're not seeing that caseload, like maybe you're doing all cumulative trauma and you're not seeing some of the acute trauma and those things, then I think you're at a little bit of a disadvantage as well. And not that you can't learn it, I think you can learn it through textbooks, but so much of the exam you can, refer back to your own caseload and say, like, oh, I remembered I had that patient with the SL rupture and he injured it because the cop twisted his arm, right? So there
yeah,
might be a question saying this patient was injured through a twisting mechanism, and you can refer back to that data you have from seeing patients to help you answer some of those questions. So I think some of it is just maybe not having as much clinical experience. Like 3 years isn't that long, right? You're still
yeah,
pretty new, and there is so much to learn, right? Like I think and I've read Rehab of the Hand probably a few times, and I'll still pick it up to look up something and be like, gosh, I never knew that, right?
yep,
Like,
yep,
how many times do you do that? And you're like, oh, how did I go 17, 18 years? And, we're in the books a lot and still learning. So,
yeah, yeah. I think that speaks to another reason people may struggle to pass is lacking some structure and organization to their studying. To have something that says, here's something that says I'm going to hit all of the topics I need to in a systematic way, and something that's not just like, I don't know, here's just like when you and I passed the test, it was you had Rehab of the Hand, you had the Purple Book, and then you had therapists who had done it before you. You were making your own flashcards or borrowing someone else's. There's just not a lot of structure other than the chapters of Rehab of the Hand, and it just seems daunting to make it through all of that. So I think having a plan in place to say, like, I know I'm on track, I'm on pace for it, for however long out I am from taking it, having something to make sure I haven't missed a topic or content area or nuance of something, like having that structure people talk about a lot, like that's what kept them the first time from passing.
I think that's a really good point. I think it's like when you organize your notes and you organize all this information that you're consuming, right? Because you're consuming a ton of information when you're studying. And if it's all organized and you know where it's at, like in your binder, it makes it easier for test recalling, right? You can go back in your brain and be like, oh, yeah, I remember doing that section. And, they even say like color coding your notes and stuff like that. You could refer back to some of those cues to help you remember stuff. So
Yeah.
I think that is a very good one, and organization is pretty big, and that doesn't come naturally for me.
It's my love language is organization.
Yeah, I know that. That's why. But I think it's a really good point you bring up.
Yeah, yeah. All right. Well, let us know if you have any other reasons, anything else that maybe kept you from passing the first time or things you're worried about. Certainly give us some feedback. If you have any questions, reach out to us on our email, info@handtherapyacademy.com, or on our social media platforms, Hand Therapy Academy.